Good morning, everyone, and greetings from Columbus, Ohio at Prevention Action Alliance. It is Friday, October 13th, and I am excited to be here with Tony Coder. My name is Brittany Sandidge, and I work with the coalition groups here and with the Statewide Prevention Coalition Association. We have a good day planned. We have a couple of comments and guest speakers from some folks across the state that we're going to turn it over to. Before I get going, I just want to do one or two quick housekeeping items. As a reminder, when emails come out roughly 3 hours after the broadcast, they will have in them your certificate for attending today's webinar. In addition, they're going to have a link to one of the documents that we talk about today. So I would encourage you to make sure that you watch for that. As we are moving through and having a couple speakers on today, please submit any questions you've got into your question box, and I will be monitoring that as we go. And that way we'll try to get to them in live time, but at the very worst case, we'll get to them towards the end of the broadcast today. One of the first things that we want to talk about on the agenda are some of the recent H.O.P.E.S task force roundtables that have been happening across Ohio. As many of you have seen coming out of the SPCA alerts, we've been trying to keep folks aware and kind of up to date as best we can on where some of those H.O.P.E.S task force meetings are going to be happening. What we've got for you today, I wanted to share with you the form that most of these roundtable conversations are kind of formatted around. And then we're going to have a few guests talk about their experiences in the conversation, what you can know and what might be helpful to you if you're planning to attend some of the ones that are coming up. Also on screen right now, you'll see the contact information for Andrew. He's the legislative aide who's working with the speaker to really focus on getting these organized, making sure that community members are there, they're present, and that they have a voice in this. So he's an additional resource to you to reach out to if you're considering moving forward or if you've attended one of these events and you're looking to have a little bit of follow-up with him. So very briefly, you'll see on screen right now we've put all of the H.O.P.E.S task force dates online on your screen for you. For those of you who are potentially a little bit behind, one of the intentions with these H.O.P.E.S task force meetings is to go around the state of Ohio and to connect with communities, with professionals, with those who are impacted by addiction, and also on the service delivery and enforcement side, to look at the opiate crisis, to look at what our communities need, are doing well, and that sort of a thing. I have just a few representations on screen. As you can see, we've had ample number of coalitions from across the state agree to participate. A few have had the great opportunity to speak on their panels, and we're going to hear from a few of those individuals today. So without any further ado, I'd like to introduce MAry Haag. MAry is with Prevention First, which is based out of the Cincinnati area, and MAry had a chance to actually participate on the panel down in Cincinnati in early October. MAry, would you mind sharing your experience?
Certainly. Thanks, Brittany, for having me. So as you guys know, I'm MAry Haag with Prevention First, the president and CEO. And I did attend our day earlier this month. And I was invited, first of all, by my one of my board members who was also on the round table. So not directly from Senator Sprague's office, or Representative Sprague's office. I am grateful to Marcy for being there and actually getting me a seat at the table. So otherwise I would have been stuck in the audience. So it was just much more beneficial to be actually at and around the table, which I was 5 years ago when he led the brigade that went across the state as well. So the way it went for us down here is his first question. Well, they shared, and I mentioned this, so maybe we can get this to folks, but they shared highlights of recent legislation from that's been enacted. And if we could get a clean copy to the rest of the group, then you can see what has been done. And the reason I say this is I use this to form my talking points. The general consensus from the group focused on, and I know everybody that was at the table because we worked together with our coalition. So that was particularly our heroin coalition that's in Hamilton County. there were folks there from Butler County and Claremont County there too, so that was good. But the highlights, his first question was, what's working? So of course, our group down here focuses on the QRT teams, but there was some people that said, that's not a silver bullet, because the bottom line message from our group was we need a comprehensive approach, and we need an approach that goes across the curriculum, or the continuum. So I was really pleased to hear that, was particularly from some of our treatment folks. I was pleased to hear that. My focus, some of the key talking points for me was ensuring that the work that's being done around health education standards continues to move forward in order to have some effectiveness from the legislation about curriculum around the problem. Another emphasis for me was children being impacted in families with addiction. There's not been a lot of action towards there, and I think that is still a weak area where we could be doing better statewide. I promoted funding for community coalitions because they do take a comprehensive approach, and there is no state direct funding for every coalition, across our state. Wouldn't that be wonderful? The other thing that was a big topic of discussion was the issue of parity and health insurance, continuing to keep expansion of Medicaid going. And I think there was one more point that I made, trying to look here at my notes. That could have been my big three, were those three. And it was well received. We had also other representatives from our region there. So whoever is on Representative Sprague's team, plus some of our local reps, were present there. So some of whom I know and have a relationships with. So it was really good. The dialogue was good, and lots of listening. And we all seemed to be on the same page.
Thank you very much, Mary, for sharing. And it's exciting to hear that there were such a nice presentation of prevention-based coalitions that were down there that were able to attend. As everyone can see, there are still several more opportunities that are going to be coming up, including one here in the Columbus area. And so we will do everything we can to share some of the takeaways from these conversations with you in the aftermath. So again, make sure that you're checking those emails that you get from us after the webinar today. Next up, to share from the Toledo area, we have Amy Barrett with the Awake Community Coalition. I want to give her a chance to share a little bit about what her experience looked like and some of the things that are facing their community. Amy, would you mind sharing?
Good morning. Thank you, Brittany, for asking us to attend. I am the Executive Director for the Awake Community Coalition, which is located in Northwest Ohio, roughly about 20 minutes from Bowling Green area, which is where our task force meeting roundtable took place. A lot of the same of what Mary discussed, although our general focus seemed to be more on intervention and treatment. We had a lot of treatment, both youth and adults, hospital system there as well. Some things that are working would be our Project Direct Link, which is in Wood County and in Lucas County. And that's one thing I was sharing earlier with Brittany, is I wish we would have been able to expand that roundtable to Lucas County and invite some people from Lucas County, which is the neighboring county, to Wood County. Some of the same concerns about the health education and what we're doing around that in the prevention world, as we tend to get wrapped up in the intervention and treatment part. Sometimes the prevention piece, starting earlier with our youth, gets lost. So it was a nice discussion around that at our roundtable, but very well organized. Lots of attendance. It was a packed house, which was really good to see everybody coming together to work together for the better of our communities. Are there any questions you have for me?
Amy, this is Brittany. Thank you very much for sharing. I'm seeing that a few people are starting to turn in some comments, and we've gotten one comment in particular that just pertains to anyone who's attending these communities that are currently using SPCA. Perhaps those are types of things that we can talk about that have a community impact in terms of understanding what's going on in the community, helping with get referrals of services and that sort of a thing. So that was important. Amy, thank you very much for being here. I really appreciate both you and MAry weighing in. I think what is most difficult whenever we have these types of opportunities is to coordinate people all over and understand that we have some different needs. We also have some really innovative things happening in different regions that don't always get showcased. So appreciate you guys sharing with the group, and I also appreciate all the individuals who are on the call today that have also been going to these. If I could just have an hour to let you all share, I would. But then you might not log into my future webinars. So thank you. Ladies, if you'll both stay on the line for a couple minutes, if questions roll in, I'll try to direct them to you. Thank you again for sharing.
Thank you.
All right. At this point in the conversation, I want to turn this over to Tony Coder, working with our advocacy and our public policy. He has got a number of State House updates for us today, as well as some insights on marijuana and some new research that's going on. So, Tony, if you would take it away.
Colleges would be impacted by bullying and by this bill if this were passed. So we're watching this definitely to see what kind of impacts this might make on colleges, on schools, what even the discipline system would be, and quite frankly, what's the most frightening thing to me when we talk about very vague terms of bullying is that many times there's overthinking of the term. So it's also I think there probably should be some protections of we don't want bullying in school, but what's considered bullying? The definition of bullying is very vague in both of these bills. So I think that's something we have to think about, and especially for those who are who work in your schools, it's something that you might want to have conversations with your school administrators about what their considerations of bullying are, and what this bill might bring upon them. There's also House Bill 348 is a new bill, a drug trafficking bill. Basically, it's trafficking of fentanyl and carfentanil. The penalties are strengthened. 3 to 5 grams would now be a third-degree felony, which is that's higher than what it is now. So that's that will probably somehow get passed. I'm guessing by the end of the spring next year. Another interesting bill that might have some impact on what you're doing out in the field is Senate Bill 71. Senate Bill 71 passed the Senate, so it's now in the House, and they will debate debate the issue. It's the Senate Bill 71 is agency contracts, which would allow boards of mental health and drug addiction and MHAS boards to basically be able to spend $50,000 without board approval. So that would be some of your smaller projects and those types of things, but it would be, that's not allowed right now. So I quite frankly think this will end up getting passed in the House. Some of the conversations I've had with folks downtown when I'm downtown think that might be something that is going to happen next year. So as you're thinking of smaller projects, I mean, this might actually lift off an impediment to getting money faster out to communities. I actually think it's a pretty good bill. The less red tape we have to go through to get money out to communities, which is where we want it. To be held up at boards because until next board meeting or whatever is kind of silly. And I think that's the impetus for this bill. So getting it out and into communities where it needs to be, is probably a good thing. So we're going to keep a close eye on it. You might even want to write your legislator or contact your legislator and just say again, but this is going to be lobbying, but say I do support Senate Bill 71 for communities it will improve the timeliness of getting money out to communities, which is where it needs to be. So those are what really kind of hopping at the State House. This week as well, we had the Rocky Mountain Haida Report. Volume 5 was released by Tom Gorman and the gang at the Rocky Mountain Haida. We have had a couple of volumes of this, and this is the latest and greatest. And really it's a long, it's 160 or 70 pages, but it's got a lot of great information on there, which is what we need to educate our communities. And this is without, frankly, they get attacked an awful lot because it is a lot of bad stuff that's coming out of Colorado. So this report gets hit pretty hard. But it's all based on numbers that it's hard to argue with data. So let's just discredit the Haida report is what the thinking is. But what we're seeing is that marijuana-related traffic deaths have increased 66% since legalization, and marijuana-related traffic deaths have more than doubled when the driver has pot in his or her system. Now, the driver could have pot and not be killed themselves, but there's been some bicyclists hit and motorcycles, and so it's not just the person who is driving that is killed, but the driver kills someone and has pot in his or her system. So the roads are more dangerous. We know that this is a huge concern for not only Colorado but Washington. California is another big state having a huge issue, and this is just medical they have out there. Their recreational system's not up yet. They're having a huge issue with drug driving. In fact, there was a meeting yesterday at the Heritage Foundation in D.C. that addressed a lot of this on what they're going to be doing. There needs to be a national campaign about this. Also in the report, youth past month marijuana use increased 12% in the 3 years since legalization, prior to the years, from years prior. So what we're hearing is over and over that, youth use is declining. Well, this report actually uses, data from all of Colorado instead of cherry-picked data like the Healthy Kids Colorado survey, and we've seen an increase of 12% since legalization. Past month marijuana use for for adults was actually for kids were 55% higher than a national average. So, there's a much bigger pot problem in Colorado than there is in other parts of the country. Colorado college age past month marijuana use is up 16%, and their rate is actually 124% higher than the national average as well. We're talking about folks who are going to be entering the workplace, trying to find jobs. Can they pass a drug test? Are they able to actually finish college? All that, all of that is reduced when pot is involved in a person's life. So that's pretty devastating as well for the economy of Colorado. I talked to a construction, the largest construction group in Colorado, and they said that they are actually having to bring in workers from Wyoming and Nebraska because nobody can pass a drug test anymore. They can't even use Colorado employees anymore, and they're worried more about people falling off of roofs and dropping hammers on other people. I mean, just doing silly things that could actually bring someone else's health into question. You get a hammer dropped on your head. That's probably not the best thing to happen. Although some people have claimed that I have. But so this is really concerning to us that so many youth are using compared to other parts of the country. We also see the yearly rate of ER visits due to pot has increased 35% since legalization. So more and more folks are using ERs to deal with mostly psychosis, psychotic episodes, psychotic breaks that they're having. This is costing hospitals quite a bit of money. And especially now with what's going on in Washington and the president's dismantling the healthcare system, Obamacare, more and more people will probably be uninsured because there will not be subsidies to help with some of the healthcare costs that the Affordable Health Care Act has had. Hospitalizations. So not only are ER visits, which is ER, many times you're released back into the wild, as they say, but back into your community. But also hospitalizations due to marijuana have risen 72%. So it's not folks who just come in, come back down off of their psychotic break or psychotic episode, but then they also end up staying the night or multiple nights. Highway interdiction seizures have increased 43%. So that means that that's illegal marijuana. These are not seizures, health-related seizures. These are seizures of product by law enforcement on the road. So those have increased 43%. Also, crime in Denver has increased 6% since legalization, and Colorado crime as a whole has increased 11%. We talk about tax revenue, how it's going to save budgets. I talked to Kentucky. I literally spoke to a hearing on Kentucky yesterday. And, Colorado tax revenue made up less than 1% of Colorado's total budget. This is not a budget fix. It's not a budget, budget patch. This is such a tiny amount compared to what the entire budget is that, really doesn't make that much of a difference. And the cost of legalization actually eat up any profits that you might make, any tax revenue that you might make. So that's some of the things that we have for the Colorado HIDE report. There was also a study released within the past couple of weeks that shows that marijuana use goes hand in hand with increased prescription opioid abuse. There was a study done by the American Journal of Psychiatry released just a couple of weeks ago, and it shows that marijuana users had a more than twice the likelihood to develop an opioid use disorder or use opioids for non-medical use. So the whole piece about marijuana will fix your opioid problem is absolutely false, according to this study, because if you use marijuana, you have a more than twice as high likelihood to to actually experiment with opiates as compared to those who never have used marijuana. So I think that's kind of an interesting study. Would really encourage you to get that type of information out to your community, out to your community leaders. Marijuana is not going to fix the opioid crisis. And then one last thing I just literally had texted to me. It's a thing called Slack, but I'll just say it's a text. There was a study done by Liberty Mutual and SAD that was just released October 12th, which was yesterday. Smoking marijuana and driving. They did a big survey. What was interesting about the survey was that, and this is where we really need to talk to our young people. We talked a little bit about drug driving deaths from marijuana. 33% of kids say that if marijuana is legal in the states where it's recreational, it is legal to drive with it as well. So as we're facing legal marijuana here in the state of Ohio, medicinal, there's also probably, and the interesting part is parents kind of mirrored that. The 27% of parents think that, well, if it's legal in the state, you're also allowed to drive while high. So that's kind of an interesting twist on things. So we really need to educate our communities about driving while high. It's not, there's a twice the likelihood to get into an accident. Drug driving deaths are marijuana-related drug driving deaths are really increasing, not only in Colorado where it's really booming, but also across the country. It's a real problem. So this is something that I can send to Brittany, and then she can send out this study from the U.S. It was published in the USA Today. So good stuff that we can share with our communities, and actually, pretty imperative that we do, especially our young people in high school who are of driving age.
Thank you very much, Tony. We do have a couple of questions that are slowly coming in. For those of you who are asking about whether or not you can access the slides, absolutely. If you've already sent me a private link, you'll have access to those slides as soon as I get off here today. But we'll also make those available to you via a link embedded with the YouTube video when it goes live tomorrow. So that's an option. Tony, we had a question, and I'm going to go back to the slides. You'll have a chance to see what we're discussing. There's some clarification requested around the tax revenue. You had said less than 1%, and we see the 0.8%. Can you just talk a little bit more about what you meant there?
Yeah, so 0.8%. So a lot of, if I said 0.08, that would be 8%. So 0.8% is actually less than 1%. So it's not even 1% of the total Colorado budget. So, they'll bring out, earlier this year, the marijuana industry brought out a big check, a $500 million check. Well, that's 4 years of legalization. 3 years, I guess, of legalization. And really, when you're talking about, $200 million, sounds like a lot. But when you're talking about, a budget that is, in the $40 to $50 billion range, it's not a whole lot of money that you're talking about. So that is actually less than 1%, 0.8%. It's not 0.08, and so I was never good in math, so thank you for the clarification, or thank you for allowing me to clarify.
Thank you very much, Tony. For those of you who are also sending in asking whether or not we can get the previous clean version from the H.O.P.E.S Task Force roundtables, I've gotten a couple questions about whether we can get that out. Yes, you will get a link to that in addition to the empty concerns and comments form link that we provided when you get the follow-up to the webinar today. It will also be included in the next SPCA e-news that goes out. However, that will most likely not be today, so I just wanted to kind of give you a warning. If you're looking for it quickly, look for it in the GoToWebinar follow-up that you get. With that in mind, Tony, I wanted to ask you just a little bit of insight into with where we are with medical marijuana here in the state. Are you hearing any kind of noise, any kind of opportunities that are going in our direction in some of the conversations that you're hearing? Just give us a quick little flavor on what's going on here in Ohio.
What's going on here in Ohio is, everyone is waiting for where these dispensaries are going to be located at, where the grow sites are. The grow sites are the big issue. That's where people are most concerned about. That's where the most money is going to be made. So we're waiting. We're waiting for that. Continues to be a huge push for marijuana delivery in the state. We had that blocked in one of the meetings that we had. However, there's a group called Weed Maps that funds an awful lot of advocacy in favor of pot. They've done it this past year. Lots of billboards actually across the country from Weed Maps, claiming, even though they've been proven false over and over and over by news stations across the country, showing that for states that have legalized marijuana, there's a 25% reduction in opioid use. It's absolutely false. But this group are the group who are pushing marijuana delivery. Why are they doing that? Because if you need someone delivered, you actually log into an app called Weed Maps that you can download onto your phone. So that's where the majority of the push is right now. And then also, we expect. I was speaking to someone in the administration a couple of weeks ago, and they are lining up for lawsuits. The day after everything's announced, the lawsuits they know will happen the next day. So that's where we are right now. I think again, it's pretty important that you're communicating to your communities about edibles. That will definitely be an issue. The hash oils are another thing. It looks like kind of sticky honey, or and if in its harder form, it looks like a waxy substance. So doing that's all going to be legal, but delivery is what we're trying to fight right now.
Thanks. We had an additional question come in as well. What is the deadline for communities to place legislation that can prevent dispensaries from coming into their town?
It's almost too late right now, because what's going to happen? You have a bigger, much bigger opportunity to get sued. Because the application process is out, you're going to have to do it before it's named. And if they're talking about naming these groups, naming these 24 grow sites in the state in the early part of November, I've heard the first week of November. We're what is it? October 13th today. So we're talking less than 3 weeks. That's a pretty aggressive timeline to try to get a ban in place. So it's almost too late. I wish I was a little more positive about that. But you probably stand a lot more chance of getting sued, your municipality, and getting sued because this ban was not in place, and all of a sudden, especially if they get chosen, they spend a lot of money on land and probably getting folks ready, because they're going to have to hit the ground running to get this thing started. So, you can still try, but it's going to have to be within the next couple of weeks that ban has to be established.
I think it's also important for us all to remember that at a community level, we all know this who work in coalitions, it's all relationship driven. So while some of the legal obstacles might be there, having conversations, continuing to educate, that's going to go just as far in impacting the health, the community culture that we live in. So certainly encouraging everyone to not hesitate to back down from these conversations. If anything, as awareness is growing, there's going to be more questions, and for all of us to be able to answer those questions, I think is very, very key. Tony, do you have any kind of parting thoughts on what coalitions should be focusing on now in light of the State House updates, as well as any of the marijuana updates?
Well, I think yeah, you do focus on the H.O.P.E.S task force. You know, everyone should probably be, you know, talking something about opiates. You know, quite frankly, we're seeing across the country cocaine is starting to take over. In California, meth is a much bigger problem than opiates. You know, I think going back to, you know, very basic talking points about addiction, and, you know, about, you know, the curriculum of care, and that, you know, as soon as opiates are crushed, I mean, we're seeing it in California. You know, meth is booming. So we're just going to go on to the next piece. We're continually going to play that whack-a-mole game, that when we crush one, another one will pop up. This is not about the drug. It has to be about communities. It's got to be about individuals. It's got to be about people and curing a disease, not about trying to, you know, the drugs are always going to be there. So I think that's very important. I would get into, since there seems to be an issue, you know, a couple bills about bullying, I would definitely get into your schools and see what, you know, what the bullying guidelines are, and see, you know, that's going to impact the kids that you serve. And you know, there might be a kid that, you know, this is always my fear, there might be some kid that makes some offhanded comment, like me when I was young, and that be taken as, you know, someone get their feelings hurt, that be taken as bullying. I mean, we absolutely need to protect young people from being bullied in school. I 100% agree with that. But like everything else, you know, that seems to happen with legislation, then we go way, you know, the pendulum swings to the other side, where, you know, I don't like you. You know, some kids saying, I don't like you at you know, during a recess in second grade. You know, is that considered bullying? I think there has to be some bullying guidelines, and there's not a good definition of this in either of the bills, what bullying is.
Thank you, Tony. Thank you all for making this such an engaging conversation. I'm getting questions and comments coming in left and right here. We do want to be mindful of your time. I know we're going a few minutes over. We try really hard to keep this kind of your fast way to get information, but there are two quick comments that I want to make sure to share with the group. I think it does have larger relevance. One, Tony, we got some insight from one of the communities that they've placed their third moratorium on medical marijuana, but also for communities to be thinking about, is there any impact we can have on monitoring, on inspecting, on those sorts of guidelines?
We absolutely. I have spoken to some at the department. I've spoken to you know, some folks in law enforcement. My biggest fear in all of this, and I will give Colorado credit this. I'll give the Rocky Mountain. I like Tom Gorman, so there, you know, I do have some bias here, but Tom Gorman did a very good job about taking baseline data. We don't have baseline data in this state. We don't know whether we have individual community data. We don't have any kind of statewide data. So anytime that, you know, you are able to, you know, speak to your community members, your mayors, your county commissioners, you know, whoever it is, you know, and even at the state meetings that are had, you know, maybe the next SPCA meeting, you know, might be good during the legislative piece, that we talk about how can we create a plan to get some statewide data, because we are terribly behind on that. We have a system that's going to be up in September of 2018, and my fear is that we don't have data on marijuana, and so we will not be effective in being able to keep legalizers at bay. You know, they're going to just say, well, you know, where's your increase at? You know, we don't have any data for that. That's going to be incredibly important. And I don't know who asked that question, but that is such a valid point. So, you know, if you can push data at the community level, at the state level, that is absolutely needed, because I am really, you know, seeing other states, they are much farther ahead than we are at collecting that baseline data to be able to measure the impacts of legalization. It's almost like not even on our mind at this point. And I don't mean to slam anybody. I know that, you know, folks might get their noses out of joint, but I'm just, being, I'm quite frankly very fearful about that.
Tony, as always, thank you so much for bringing the national perspective and State House updates to us. Thank you all for your questions, for helping to keep us aware of how this manifests at the ground level, what happens in your local communities. Just one quick final plug, for those of you who were at the previous SPCA meeting, the first one we've held at Prevention Action Alliance, I hated that I missed it. I missed you all so much. I heard it was a good meeting, and we had a record 51 people in the room throughout the course of the day. So please make sure as we move forward for the November meeting that's going to happen the Tuesday before Thanksgiving that you are RSVPing. So I've got the right amount of chairs in the room for everybody. We will be focusing quite a bit on advocacy as well during that particular meeting. But we're also going to focus a lot on networking in November. So I would encourage all of you to come out to hear more from Tony, to hear from each other on what some things are that are going on locally. You can register on our website on the events pane. As always, it is a pleasure to serve you and to be here in Columbus. If you have any further questions, do not hesitate to reach out to any members of our staff. We wish you a wonderful weekend, a safe one, and we will be returning in November as well on our regularly scheduled Tuesday webinars. This is a one-time only, just throwing you off for the month of Halloween, I guess. So we'll talk to you all again in November. Thank you so much and have a great day.